media conference last week, and I just want to say I was just immediately impressed with his grasp of COVID related issues and his ease at responding to questions. We're so incredibly fortunate to have him as the current Mecklenburg County Health Director. So, especially as a successor to Gibby Harris, who served so honorably in that role. I want to tell you a little bit about his background. He received his Bachelor of Science from the University of Pittsburgh and his Master's of Public Health and Epidemiology in 2008. He went on to receive his doctorate in epidemiology in 2012 from the University of Pittsburgh and served as an epidemiologist research scientist in Rockville, Maryland for 4 years following the receipt of his doctorate. In 2017, he became the chief epidemiologist for the city of Philadelphia, and he worked there for a little more than 3 years. In March of 2020, we were fortunate to get him as the deputy director for Meck County, and he became the director in January of this year following Gibby's retirement. Dr. Washington has, I would dare say, an incredible amount of work on his plate. And so having him take time from his schedule to join us today is just very much appreciated. And I do know for a fact that he moved an appointment that he had at this time just to be able to facilitate this presentation. And I am so grateful to you for doing that, Dr. Washington. Without any further ado, Dr. Washington, the floor is yours, sir.
Sure. Well, thanks for that gracious introduction, and good to be with you guys this morning. I got to tell you, I appreciate just sitting here listening to folks laughing and talking about non-COVID stuff. It's quite a pleasure. So I'll just quickly, guys, give you an update of where things are in the county, but more importantly, just want to make the best use of our time by answering whatever questions folks here may have, and you all tell me what's most helpful. As you probably know, we're in the middle of a pretty bad surge related to the spread of the Omicron variant. Omicron is a lot more transmissible than prior variants, including the Delta variant. That's the bad news. So it's a lot of it. It came in a really bad time because it happened right around the holiday season, where people were obviously gathering for Thanksgiving and for Christmas, and all kinds of activity was happening. So we expected a surge this time of year because of that, but certainly with a more transmissible bug in the air, that created really sort of exponential growth in our case count over a short window of time. So it's tough right now, but I think our systems are in place. We've learned a lot about COVID. We've got a lot of incredible tools in our toolbox to be able to respond to COVID. We've got vaccines at work. We've got booster shots available to everybody who probably needs one. We've also got availability of masks in the community. We obviously have a mandate. We're encouraging folks to adhere to it as much as possible. We've also got a whole portfolio of treatments that are effective now for folks to keep them from getting as sick. And so all those things are helpful. And the reality is COVID's here. It's in Mecklenburg, North Carolina, the United States, the world. We're not on a pathway towards eradication. So we've got to learn to live with it. And so as a part of that, really, it means we got to use the tools that we have, just like with everything else, so that we can continue to live everyday life, whether it be working, providing essential services, or just doing the things that we all enjoy to do. So that's kind of where we are right now. We are experiencing a huge demand in testing. We have been for the last 4 weeks. And that demand has overwhelmed the system. Just to be quite frank, it is overwhelmed. And that's where we are. And we are hoping that we are at a better place in the next couple of weeks. If this sort of epidemiological curve goes the way that it has gone in other countries who are a little bit further ahead in their experience of Omicron, we are expecting that they will we'll have just maybe 2 to 3 more weeks of really dark days, and then things hopefully should start to stabilize here a little bit. We are starting to see some early reduction in the demand for testing, which is good. Part of that might just be frustration, but some of that might be a little bit of impact of folks starting to recover. One other important point I'll make is that the infections do seem to be less severe with Omicron. People are having much more mild illness. Part of that, of course, is due to the fact that we've got more than 60% of our population vaccinated. So that helps, right? Because the point of the vaccine really is to make sure folks can survive the illness and don't need advanced healthcare resources. So that is ringing true across the board. Even for those patients that are unvaccinated, we are seeing fewer people need those really high acuity healthcare services like the intensive care unit or respirators, which is a good sign. But our hospitals are stressed, specifically the emergency departments are seeing volumes that they've never seen before. And some of that's because people are going there to get tested. So that's sort of the lay of the land and what's happening on the ground here in Mecklenburg. The CDC did recently update their guidance relative to isolation and quarantine, which is, I know, been very confusing for a lot of people because it's kind of rolled out in an iterative fashion and so instead of all at once. But the long and short of it is, if you've got COVID, you get diagnosed, or you assume you have COVID because you're sick, the recommendation is to stay home until you feel better. And that's sort of the simplest way for me to communicate to people, how to keep themselves from infecting other people, and how themselves to, what's the best course of action to protect those around us. So isolate if you don't feel well. You want to do that for at least 5 days. As long as you don't have a fever and your symptoms are better, then you can, get out of isolation if you got to go back to work or something. But we just ask that after you leave isolation early, that you go ahead and wear a mask really, really diligently, and that the next 5 days up until day 10 from when you first got sick, it's important for you to wear a mask very closely to your face and make sure that you're, limiting your contact with people, but you can get out of isolation. So that's sort of the long and short of it. We're doing everything we can to keep our schools open. As somebody mentioned, we didn't get a blizzard. So even though I personally probably would have been okay with one, just to slow people down a little bit, but we didn't get a blizzard here. So the weather was actually really nice over Christmas. And so that led us to the situation that we're in today. So that's kind of the lay of the land. We are working to get more rapid test kits into the community, and making sure folks have access to what they need. The biggest message, though, is we need everybody to get vaccinated and get their boosters. That they work. I mean, if you look at the hospitals right now, almost 100% of the people who are in intensive care are those residents here who opted not to get vaccinated. And nearly, 80 to 85% of the folks who are even in the hospital for COVID-like illness are folks who are not vaccinated yet. And so we know the vaccines work. They're protecting our elders, our seniors who are living in long-term care facilities. They are really, they're effective. They work and they keep people well. So I think we need to continue to bring that message along to everybody, and then also start to normalize the fact that COVID's with us and we've got to learn to live with it.
I have a question, and I'm sure a lot of folks have questions. So I'm actually going to flip my view back to gallery so I can see everybody. But I've got a couple, so I'm just going to throw them out and then you can answer them. And if anyone else has the same question, that'll be good. I've heard that masks aren't as effective. Even the N95 are not as effective as the Omicron virus. And what do you tell people who more than likely are asymptomatic? So like I've been exposed now to COVID twice. I've since gone and got tested, but I've never had any symptoms and I've come back negative both times. But my instinct is that if I were to catch it, I would be asymptomatic. So how does someone like me protect my loved ones and colleagues from me spreading it?
Sure. So I'll say two things on mask. Of course, all evidence is clear that masks still offer protection against transmission as well as both-way transmission. So we are confident that masks are an important tool in our fight against reducing transmission in the community. No intervention is perfect, right? So there are a lot of loopholes in mask wearing. People don't wear them properly. People don't secure them close enough to their face. It's not, there's all kinds of things that can contribute to the mask not being as effective as it could be. Certainly, medical grade masks are more protective. They offer more protection than a cloth mask might, or two masks is more protection than one. And we, as epidemiologists, talk in levels of risk, right? So this is really a matter of what's the most protective. Obviously, the best protection is a respirator mask that is fit tested. So that is an N95 that has been tested and secured to your face. That happens. We can't fit test everybody in the community though. So that's a whole process that medical professionals go through to make sure it fits their face properly. That's gold standard, top of the line. But even those with, extended exposure for days, you could transmit a virus. You go down the tiers of those masks not being fit tested, and then you go down to even other medical grade masks that are like surgical masks, and then you have cloth masks that again offer a level of protection. Again, it's no intervention is perfect, but it does offer greater protection than not wearing it at all. And that's the point that we try to drive home with folks who have questions about the effectiveness of it. And we are encouraging people right now to use those medical grade masks if they have access to them, and are working to make some more available, particularly for our residents who can't afford it. For asymptomatic people, it is difficult, of course, to know when if you have an infection and you don't know you have it, which is why it's still important to wear masks around individuals who are really vulnerable. So, like I wouldn't go into a space with a person that either has an underlying health condition, they're immunocompromised, or they're older, without a mask on at all right now, personally, just because for me, it's not worth the risk. I'm okay being uncomfortable in a mask for however long to make sure that I'm protecting that individual in case I do have asymptomatic infection. But of course, the vaccines are working, and they do help your body sort of clear their infection. So even if you are exposed, and as you said, you've been exposed twice, you could have been exposed and the virus got into your body, and your body was just able to clear it before you ever developed enough infection to be sent that the test could detect. And so that's important. That's an important part of the message with why we see lower infection rates in people who are vaccinated. But the vaccines don't stop you from being exposed. So those exposures are going to happen. But the good news is if you get exposed, most of the time, I know a lot of folks who've had post-vaccination infections in the last several weeks, and they're all doing fine. I mean, they're at home, they may have a cough, they may have a little bit of a sniffle, but in general, they're doing okay, which is exactly what we want to see.
Dr. Washington, I've got a question for you, actually two questions. First of all, we are a service organization. We get out, we do volunteer work throughout the community. Can you give us some parameters on what the best practices might be for continuing our service activities? That's question number one. Question number two is, my wife and I are babysitting our 2-year-old 3-4 days a week. We want to do everything we can to make sure that we minimize the risk to him. How does Omicron manifest itself in small children of that age, and what can we do to make sure that we keep him safe?
Yeah. So on the first front, actually, I'll take the second one first, and then I'll go back to the first one.
Okay.
I think that the same is true with everybody. Obviously, our 2-year-olds can't get vaccinated at this time. Most little kids who are becoming infected are doing well. I mean, their infections tend to be pretty mild. We have very few, some places across the country have seen some really significant increases in pediatric hospitalizations. We have not seen that here locally. Our kids that have been infected seem to be doing well. And right now, most of the cases are actually in our young adults and not in kids. And so I think the important thing is, of course, those kids could become incredibly ill. And so you don't want to take that risk. And so I think continue to do all the things that you can do outside of the time that you're with the kid to make sure you don't yourself have an infection is the most important thing. Relative to activities, I think, again, I reflect back on my earlier comment that COVID's here and we got to deal with it, right? And so we at the department can't close the department. We don't need to close schools because we've got to, there are things in life that we just have to do. And so we've got to figure out how to use the tools that we have to do those things more safely. There will always be risk. There is always going to be some level of risk in whatever you do, whether it's going to be coming to this health department every day, working in a clinic, doing a community service activity. Yes, there will be some level of risk. So what our thinking has to be, how do we do this and make it less risky and figure out what those opportunities are. So of course, things like wearing masks, having people vaccinated are first top of mind things you can do, but also trying to implement, environmental controls so people don't have as much opportunity to transmit infections. You don't want crowded rooms of people. So how can we reorganize, or how can we adjust what we're doing to make it more safely, do it more safely? And think, okay, what are the tools that we can implement? Can we spread seats out? Can we do this outside instead of indoor so that we can lessen the touch? Can we incorporate virtual components so that we can still get the work done, but without having people gathered in one room? Are there ways for us to, develop, drop off pickup services or things where people don't have to do? How do we modify what we do just to make it safer, but thinking about modification versus cancellation? And that really is where I would advise.
Wonderful. That's great advice. Thank you.
Emily.
I actually also have two questions, but mine are on like two different ends of the spectrum. So the first one is, I would love your thoughts on antibodies and building up a response. So my husband and I, like, for example, we both have had COVID twice, and we are also fully vaccinated and boosted. So it's like, we're definitely there. Like we're covered, but we also had it before we even knew, looking back, we had it before we even knew it was COVID. We had it in like end of January, beginning of February, 2020. And then we also got it this fall. But this fall I was actually asymptomatic, which was interesting. But yeah, so I'm curious on that. But on the other end of things, something that you just shared is I work for Charlotte Speech and Hearing Center, and we have actually canceled many of our events. We are doing our big 5K race in February because it'll be an outside event. But a lot of our older donors don't attend that event. That's more of our younger families, things like that. But we do an event in May that we are really having the debate of whether or not we should hold it this year or if we should hold off and do it maybe next year. That would be a gathering. It would be outside. It would be, a small group, not the big group that we usually have, but we don't want to start planning something and then have to cancel. So I'd love your thoughts come like springtime into summer. Do we think we see, I know you can't predict the future, but if we think this is kind of that, are we safe to start planning, especially if it's outside?
Yeah. So what I believe is on the horizon, and I don't have a crystal ball. But what I think will happen is we will get into a rhythm with COVID where we'll know that just like the flu, the season's coming for COVID, and COVID might cycle twice a year or 3 times a year, and we start to adjust or anticipate that it will cycle. So I think that is really an important part of our planning. Like, so how do we assume that COVID's going to be surging, so how do we reduce risk, and then what are the time periods of the year where we might think things will be a little bit better than they would be? So I definitely think coming off this Omicron surge, we're going to have a cool period. February, March might be a great time to do a lot of stuff because I think we'll have a little bit of immunity in the community, which would be good for us. So I advise that, you don't cancel, but think about sort of, what, and then have a contingency plan. If things are really crazy and something's different, then, you might want to have a backup plan to shift gears really quickly. And then on the first question, natural immunity and antibodies, it is difficult to create policies around natural immunity because everybody's natural immunity is different. And so some people get infected with COVID and, have active antibody levels that are really, really high for 11, 12, 13 months after their initial infection that offers protection to them. Other people, on the other hand, within a couple of months, their protection starts to wane and those antibodies go away. And it's not always an equation of a stronger immune system versus not. Sometimes the immune system is just one of those tricky parts of our body that essentially has its own mind. And so that's the hard part when you try to assess. And we don't have very good availability of antibody tests that can help us understand whether or not people's immunity level is enough to protect. So we haven't leaned in a lot on sort of antibodies, but we are moving forward with sort of this idea that if you've had COVID, then you've got 90 days of basically being clear, where it's unlikely that you will develop another infection. So from the time you've got COVID, 90 days after that, you don't have to isolate or quarantine anymore because it's unlikely that you'll develop another infection. What we don't know, unfortunately, is as more variants are happening, how that's going to change the equation. And so the science is still uncertain, but it's monitoring very closely how the impact is. So they're looking at cases where people have, for example, 2 variants at the same time. We've had folks with Delta and Omicron active infections at the same time, and sort of what that looks like and tracking the antibodies. But COVID is, if people don't know a lot about the flu, but the flu is the same way. I mean, the flu, we've got lots of variants of the flu circulating at one given time. And also strains too. So you have flu A and flu B. And so when we develop our annual flu vaccine, it's really a combo. It's really for this flu, this flu that are all circulating, all the flu, but just different strains. And so COVID's behaving very similarly. And so I think as we learn, we'll keep moving forward. But at some point in the next decade, I hope we'll get into a rhythm that's a lot more normal.
Are the vaccines designed the same way so that, they kind of fight off all the different strains, or are we going to start seeing boosters that are, formulated to prevent against Omicron? And
Same strain, yeah. So right now, the mRNA vaccines, so the Pfizer and Moderna vaccines, are performing really incredibly well against Omicron in terms of protecting people from illness. There's no indication at this time. Nothing's changed. We're not seeing an influx of vaccinated people who are sick. Those that we are seeing that are sick, that are vaccinated, most of those people either are not gotten their booster, and actually it's mostly haven't been boosted, and they have underlying health, like pretty significant underlying health conditions, or they're older. So even when we say 10% of the people in the hospital right now are vaccinated, I can almost guarantee you that 100% of those folks have complicating health conditions that make them either more likely to have to be sick or be in the hospital anyway. And same thing with the very few number of people who have died after vaccination. They're all almost pretty much 100% over the age of 75. Not to say that means that, but they're much older. They have complicating health conditions and probably needed another booster because their immune system just simply did not retain the information that it learned when it got the vaccine the first time.
Dr. Washington, you indicated that the testing is going down for Meck County. Could that possibly be a reflection as well of the lack of available test materials? Okay.
So that was my point. People are frustrated and tired and don't want to sit in a long line. So yeah.
But the other question is, I know the positivity rate for today is up. It's about almost 34%. And that's been kind of going up, I think, for the past 7 days, increasingly. So do you have any sense, is that the same 2 to 3 week period that you were talking about earlier, when we'll expect or can expect to see that positivity rate going down?
Yeah. So I think what's happened in other countries is it's like shot up exponentially, and then it started to come down just as fast. And so we're hopeful that happens here too, where we've seen this really rapid increase, and we are still climbing a little bit, but we are seeing some preliminary signs, again, with a little bit lower testing, a little bit lower volume in the emergency department, that we may, in the next 7 to 10 days hit the curve to come back down. And so we're hopeful that occurs here as well. And I'm personally hoping it's just as fast as it went up.
Yes.
But yeah, the holidays are a tough time. Last year, our holiday surge lasted just around to the end of January. Things really were cool by the end of the month, early February. So we're hopeful that same thing will happen. So now is definitely a difficult time to think about holding anything large or gatherings. But I am telling people to be much more cautious, because if you think about it, probably 1 in 4 persons that you would gather, somebody has COVID. So it's just a higher propensity of risk.
Actually, Dr. Washington, you're going to start feeling a lot like Brad Panovich when people are asking him, what's the weather going to be like in May when I'm getting married? Like, this is your new reality. How do we keep ourselves safe from the COVID scammers, right? So like the folks that are offering the home kits that haven't been, and gouging prices that haven't been approved by the FDA, and the testing sites that are, kind of not necessarily sanctioned.
Sure. Yeah. So the testing sites, we have pretty much on our testing website, and I hate that I have to refer people to websites, but unfortunately it's like the only thing that we have. only way we can consolidate all the providers or vendors that we have. We do have a listing of sort of our vetted testing sites on the testing site locator that you can check, and pretty much all of our COVID resources are here. I'll put it in the chat. So that's one option for sure. And then our hotline staff are able to help verify if you have a concern. So if you go to a testing site and it looks if it looks shady, or looks, I don't know if this looks like, and there's no line, it's probably something off. So you can always call our hotline staff during the day and they can help, tell you if that vendor is at least on our list that we have here that's been vetted. And I'll put their number in the chat too. So you can always call the hotline and stuff. In terms of the rapid kits, my recommendation to folks is to not buy them from any unapproved place. So they have them on Amazon. They are vetting theirs on there to make sure that they are the appropriate products. They have them on Walmart has them on their website when they're available, but get them from the pharmacy. You don't want to get them from a vendor on the side of the road or any place that looks. You just want to make sure you get it from a verifiable place that you can take it back to. That's sort of my gauge of sort of where you should be purchasing those kinds of things. And the supply chain is catching up. So there were a lot of places. There were a lot of places where there was shortages, but they're getting back on the shelves. Unfortunately, the federal agreement with the major pharmacies to keep the prices capped expired in December. So I don't know how expensive they're going to be, but the prices could be going up for the ones that are on the shelves pretty soon, unfortunately.
Okay, thanks. So don't get your COVID rapid test from the Rose vendor on the corner. Sam.
Dr. Washington, thank you so much for that information. I appreciate you being here. You mentioned something earlier that was really unique. You mentioned that most people had other underlying conditions. The question that came up in my head was, is there something that we could do to boost our natural, call it health, call it immunity, call it whatever, like that we can reduce our underlying conditions so that if we do come across COVID, we are better protected?
Yeah, so that's my favorite conversation to have with people, right? Like if people are healthy anyway, that reduces your risk of everything, right? So, we really try to be careful with our messaging because we obviously don't want to, to isolate people in our community who are experiencing health issues. So I don't want to say, hey, avoid hypertension and diabetes or, lose weight, like that kind of stuff. But I think in general, living a healthy lifestyle certainly helps you reduce your risk of any kind of health issue, right? So the basic things that we all know are essential for us to be able to keep our bodies healthy. Physical activity, our diet and what we eat is so critically important. I encourage folks, if talk to your primary care physician about what vitamins are best for you. Obviously, seeing your primary care physician on a regular basis is important because you establish a relationship and a rapport that's essential for when pandemics happen. So you have somebody to call when you need healthcare guidance or advice. And then, of course, the other things that are important to keep our minds well and keep us as individuals well, managing our stress. And of course, seeking treatment early. So if something's wrong, if you have a pain or something's different and you notice it, don't discount it as, oh, it's old age, get it checked out just to be on the safe side. Because again, if we can catch things sooner, it helps us, be able to reduce morbidity over time.
Dr. Washington, I have more of a personal question regarding the same. I'm 60, so I'm over, I'm in the older age. I'm also obese, which I am working on. But a couple of years ago, I had several knee replacement surgeries and I developed infections. So I know I'm more infection prone. Is there something more I need to do, or am I like in the higher category because of these things?
Sure. So first, I would always say to make sure you have that conversation with your physician directly. But in general, again, getting a booster shot, we made boosters available earlier for the patients who were more vulnerable in any way. And so I think making sure you stay up on vaccinations. And as the news changes, it's possible that certain folks in our community might need a fourth dose because their immunity starts to wane more quickly than others. And so just keeping up with that, but of course, talking to your physician about anything you can do to tackle those individual things you've got going on is the best course of action.
Okay, thank you.
Sure.
There's no way there are no more questions. I called BS on that one, y'all. I know you got them.
Dr. Washington, how can you tell if your immunity wanes?
A great question. You can't. And so that's one of the challenges, is that there really isn't a way to say, okay, where am I at on my immunity scale? So we have to assume that, everybody is somewhere near the average. And the average is lower for it's weighted down towards the folks who probably have the lowest level of immune response. So again, adhering to the timelines, getting a booster shot when you're eligible is the most important thing relative to COVID that you can do. And at this time, that's really it. And I think if you know you have, you're based on age or other underlying health conditions, then it's prudent for you to be more cautious in your activity. You want to reduce your risk of exposure. And so when other people take their mask off, leave yours on, watch the settings that you're going into, because again, you have a different level of risk. And we all have to make that assessment for ourselves, based on where I am, where is my level of risk, and how do I, how do I sort of, fit into this equation of risk? And is it a good idea for me to go to a crowded restaurant or bar and eat and watch the game? Probably not if I'm on the higher risk end. Lower risk, maybe so. And so I think those are the kinds of decisions we all have to make. And I think whether we had COVID or not, those are the kinds of decisions you have to make.
A follow-up question. Do you think we will see an annual booster every year coming, or maybe every 2 years?
We're trying to figure that out right now. So not enough time has passed to see how this all plays out. And so as time passed, we learn more. And so we are working right now not we in public health here, but nationally in science are working to track to see, is that third dose sufficient? Like, does it last a long time? So if you think about all the vaccines you've ever had in your life, a lot of them have multiple doses. So if you get hepatitis vaccine right now, there are 3 doses that are spread out over a 90-day period. And so that's what was determined to be enough to keep the immunity level high enough. The flu, on the other hand, because it mutates so much, we need an annual booster because the mutations are consequential and impact your protection. Now, the COVID vaccines are built differently. And so, in fact, they may not need annual doses because they're more agnostic to the variant because they're looking for the structure of the virus, like that spike protein that's on the outside. So right now, we feel pretty confident that, we won't necessarily need an annual booster, but it's a huge uncertainty too. I mean, scientifically, it makes sense, but in reality, that could be very different.
I have one question.
Marja, and then Dave.
Sorry. Do
And
we
Kate.
have enough data to, to know what the long-term effects are? Or I guess it's just 2 years old, but are people having any lingering effects that we know of?
Yeah, so definitely some folks are having what we call long COVID. And that is certainly a challenge for some folks where they're having symptoms for a pretty extended period of time. And sorry, give me 1 second. Some people are having long-term symptoms. It varies by person. Some people have had, sort of this COVID fog they talk about where, it's just hard to focus and brain's kind of cloudy sometimes. Others have had.
Sorry, isn't that old age? Isn't that motherhood?
Isn't that life?
So sorry for you. Join the crowd.
I've not had a COVID infection that I'm aware of, and I'm like, I get foggy all the time. But yes, so certainly there are some people who are having long-term symptoms, the fatigue sticks around, or but what we don't know, and to your point, that's incredibly important, is there something that develops 10 years down the road from a COVID infection that it changes your risk for something else? And we simply don't know. I mean, there are people who've had really severe infections that have had really a lot of damage to their lungs. And so what that equates to in the long term, I don't know, which is the point that we try to make to everybody. Yeah, you might feel like you have a cold and it might clear really quickly and maybe you'll be fine, right? But there could be some long-term consequences that we don't know about. And so it's good to be vaccinated, because the vaccine helps you clear the infection more quickly. And the quicker it clears, the less damage it does while it's in your body. So, the longer it's in your lungs and your respiratory tract, the more damage it can do.
Okay, thank you.
Yes, Dr. Washington, for those of us who are in the category of age and underlying conditions who have had their 2 shots and their booster, are you recommending a second booster?
I am not. No, that is not actually permitted at this time, unless you have a condition that your physician is willing to order or is advising you to get it sort of off label. And those folks who might do that at some period of time are really only, what I would imagine it would be, for example, if a patient's in treatment for cancer, or if they're on long-term immunosuppressant medicine that suppresses their immune system, their physicians can make recommendations off-label, but it's not a universal recommendation at all at this time.
Would Coumadin be one of those medicines?
I think you need to talk to your physician specifically about why you're taking it and what impact and the dosing that you have and how that might impact your own immune system. But certainly it would have to be a one-on-one decision with the physician. We actually cannot make a global recommendation because of the FDA authorization.
Thank you.
Sure.
Okay,
Okay, Dr. Washington, just a little different kind of question. What is your take on international travel at this particular time, or even as early as May this year? I've got a trip planned and I'm a little nervous.
So
Brad Panovich strikes again.
I think you'll be good in May, but I don't know that for sure. Don't get a refundable ticket. But most of the airlines have been gracious with the situation. I would not go anywhere right now. So personally, I would not feel comfortable leaving the country because now 3 weeks ago, I felt very differently about that. But right now, because of the restrictions to get back into the country and the conditions in other countries that you might visit. Now, if you're going to a place where there is not a lot of COVID at all, and it's a needed trip and not sort of vacation, it's certainly something you could consider. But the risk of being stuck someplace is you want to make sure you have resources and flexibility to be stuck if you decide to travel right now, because of the level of transmission that's happening across the world and not just here. So I would be careful with it now, but I think in the springtime, hopefully we'll be in a better position to move around a bit. With so many people getting infected, it's a good sign for at least what the cool period would look like, because we will start to develop some level of herd immunity in our community relative to this level of transmission. So I'm expecting, again, don't quote me on this, March and April, February, March and April, you might have a better chance of just having, a little bit of COVID peace.
Ranji is next, but just on Kay's point, I'm hearing a lot of people getting sick on airplanes. So airplane travel has always been sketch anyway. So, sorry, anyone who works the airlines, but, do we really believe that they've got like amazing HEPA filters, going in there?
So air quality on airplanes is actually pretty good. It's better than most buildings that you might go into. My speculation is most people are getting sick on planes either in the airport or because they're on long flights and they're eating and drinking while they're on the plane. So it's not, because you have to wear a mask on the plane, and then inappropriate mask wearing is certainly a risk. But planes are close quarters. I've been on several planes in the last several months, and I can tell you, it's the boarding and getting off the plane is where people are probably spreading stuff because they're crowding the aisles, they're crowding in the seats. It's just kind of a chaos. I really wish it was more organized. And I think, I wish that there was some kind of intervention to fix that process so that airports don't have the same kind of just stacking that is happening right now. Because that is a bigger risk, but I purely being on a plane is not sort of necessarily a higher risk than other places. And the air quality, like I said, the air in the plane completely cycles in a matter of minutes. So all the air that's in there gets out and new air is brought in from outside and it's filtered. And so that's the air quality is good on planes. It's just the stuff that happens when we're moving around on the plane.
Good to know. Ranjit.
Yeah, Dr. Washington, thank you for being here today. The question is about what demographics are we missing in terms of vaccination? What are we doing nationally to try demographics?
Ranjit, can you put your question in the chat? I'm not sure. Okay.
I got the gist of it. He's asking about, sort of disparities in vaccine uptake. We are seeing, we're continuing to see, lower uptake in our communities of color. We're also seeing lower uptake in some other sort of geographic areas, more, traditionally conservative leaning areas. We see different levels of uptake there within the county, so to speak. So we've got street teams and a whole network of folks who are doing door-to-door outreach. We're in barbershops, beauty salons, churches, and everywhere you might imagine people are. Our teams are on the ground to provide education and have those one-on-one conversations with folks about the importance of vaccination. Obviously, we have some more macro level interventions, our media campaigns and TV, radio, and the paper. And then we have a doses to door program where you can just call us up and we'll come to your door and give you the shot if you feel more comfortable. So we've really thrown everything at the wall relative to making sure that vaccines are available, accessible, easy to get to. Even now, I tell people when I'm talking to the media, like, there are folks sitting in those 5-hour lines because they don't want to get vaccinated and they have to get tested for a program. And I'm like, just go to the other line and get a shot and you'll be out of there in 15 minutes. And that's really sort of the message, but we're really working to continue to encourage folks. And there's a whole operation of people who are working on that front within the health department and across our partners.
I just want to do a time check with you, Dr. Washington, to make sure that you're still good.
I have to go. I was going to just check it out to see if there's anything.
Well, thank you so much. You've been an incredible guest, and we'll be making a donation to a charity that you choose. So just Kevin can email you and you can tell us. Or
Wonderful.
Kevin, you want to say something real quick before he jumps off?
Dr. Washington, I just want to say thank you so much. And I will email you and Sonia and get that charity.
Okay,
Thank you.
perfect. Thank you all so much for all you do.
Take care.
Bye-bye.
Bye-bye.
Thank you. He was awesome. Goodness gracious.
Yes.
And if anyone has any additional questions for him that you didn't get in, if you just want to throw them in the chat, and Kevin, maybe we can just round them up in an email and send them off and then get them back out to everybody.
Sounds good.
All right, perfect. So is there anyone who did not get to do happy dollars prior to Dr. Washington? Miss Rosemary, please give us your happiness. We can't hear you, love.
You have to unmute.
You'd think after so long we'd figure this out, right?
$10 kudos for Happy Dollars for getting Dr. Washington here on such a timely, opportune day when he has got to be absolutely